Hello, I am Dr. Kamakshi Dhanraj, breast surgeon, Apollo Hospitals. The month of October is being celebrated world over as Breast Cancer Awareness Month because this is the most common cancer occurring in women in any country, and in India this is bypassed cervical cancer in urban population. Now breast cancer seems to be the most common cancer amongst women in India. So it is important because it's estimated 1 in 28 women in India will be exposed or will get breast cancer in their lifetime. That is a phenomenal number, and we have to really look into things that whereby we can either, for most of the diseases we want to prevent if it is possible, or diagnose it early so that you can have a better treatment. So the same applies for breast cancer too. So here, especially in breast cancer, the easiest way to identify breast cancer is not necessarily by a clinician, it is by the own patient. That itself is a big advantage because all they need to do is do self-examination. So I'll be talking to you about that in more detail. What we can do to improve the survival is to diagnose it early. So what are the things that we can do to diagnose it early? So it starts from home, from the same one person, because self-examination every month has been discussed about widely, and it usually is done in a set date on every month, so that there is a routine that you can follow, and usually after the 5th day of the menstrual cycle, so that the breast is soft and supple. So unless you know what you have to look for, it's very difficult to actually pinpoint anything. So that is why nowadays self-examination is being called as being breast aware. That is, you understand your breast. So normally you have to stand in front of the mirror, look at your breasts and identify whether they are equal in size, whether you see any discrepancy. And when you do it sequentially every month, then you will see the changes. The changes are usually like there is a lump in the breast, or there is a change in the nipple, there is a nipple discharge, there is some discrepancy between the size. When these things happen, you have to go and consult a doctor. So early diagnosis is very important because if you identify the disease in stage 1 and stage 2, the survival is almost 95 to 99%. That is really great. It's almost like a cure. When you are at the stage 4 disease, the survival falls to 20%. So early detection gives you the flexibility of treatment, and you don't have to be very aggressive. And one thing that every woman is scared of about losing the breast and living a life, the quality of life, which can be addressed if it is early cancer which is cured, and then you can go for a reconstruction. Are there any risk factors? There are definitely, yes. There are, especially when the parent or a sibling is affected with the breast cancer, the incidence is likely to be high. And some unrelated factors are early menarche, late menopause, patient who has been on estrogen therapy for a long time, postmenopausal syndrome, and obesity especially. And the general actions like doing regular exercise and losing weight and being on a good diet and reducing alcohol, and all these things definitely plays a role in reducing the risk per se. So, and there is one more factor which I have to mention is if there is a family history, family gene mutation happens, and they have a higher incidence, and if there is known history in the family, then they can go for a gene test, identify, and sometimes you may be even advised as a prophylactic mastectomy. So once we diagnose early, what is the advantage? Because if it is a very small lump, then they can just do a lumpectomy or a quadrantectomy, follow it with other treatments, and so you have a chance of having your own breast preserved. And even if it is not possible, there are many reconstructive options available that can be considered. These are possible in early disease. That's one of the reasons that we need to identify the disease early on. So the take-home message will be identify the disease early, because early disease means it's cure and a very good quality life for many years to come.